your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. Well, June is Men's Health Awareness Month, and here to help me talk about that is one of my colleagues at Family Practice Associates, Dr. Jimmy Rossi. Welcome.
Happy to be here.
Okay, we talk about men's health. Well, let's just start out with the thing that's unique to men is prostate disease.
That's right. We have something that other people don't, and I get asked that every day about how we deal with the prostate. When is my prostate going to be a problem? I guess the non-surprising news, everybody's going to have a prostate problem at some point if they live long enough. And so I help them navigate that. We have a couple ways of testing things. Usually we don't have to do anything that is uncomfortable, but we definitely want to know when guys' symptoms start to show up. Prostate causes a lot of urinary symptoms.
Give me an example of some of the symptoms.
Yeah, you got an older guy, he's going to pee a little bit more during the day, maybe a little bit more at night, but then eventually he's going to start to dribble a little bit, or stream's going to get a little weaker. You definitely don't want to hear that they can't start the stream and all those things. There's other reasons for it, but usually we start looking at the prostate as it grows a little bigger and a little tighter.
Now, all prostate disease is not prostate cancer.
Correct. Yeah. Even prostate cancer, as wild as it is to say, is a lot of times a safe thing. It's something that you die with, not from, in most cases. And I know one of the stats we show, 1 in every 2 men is going to get cancer in their lifetime. A decent majority of that's going to be prostate cancer. It's just not something that that causes a lot of problems compared to other cancers.
Now, you mentioned the prostate cancer and there's the PSA blood test. You do it, you don't do it, when do you do it? Give us a little bit of information there.
Me personally, I'm going to talk with every guy around age 40, depending on family history, and we're going to decide together if we're going to do PSAs. It's something we tend to do yearly. We want to see how it changes. We don't get overly excited about the exact number, just kind of relative numbers. And it helps us know when to do more. If we don't overreact to it, we don't do procedures that aren't needed. And like I said, you can get away without a lot of prostate exams for a bunch of years. Possibly is why a lot of guys don't come to clinic. I get that question a lot. Like, do I have to do this exam? I get to tell them no. But yeah.
Well, now you mentioned a lot of guys don't come to clinic.
Don't come to clinic.
Yeah. Why is it that men seem to come less than women?
I guess there is a cultural difference, and I don't know if that will change each generation or if it's already changing, but I have at least once a week a guy come in and say, I'm only here because my wife made me. I'm only here because my job made me. And there's a lot of things we do as guys that, again, culturally might actually be a bad thing. The way we eat, the foods we eat, the jobs we take, the stress we put on our bodies, probably a big portion of that is why men live 5 to 6 years less on average than women. But another big reason, something we can actually change, is getting them to come to a clinic. You will, in general, live longer if you come see us.
Well, now you mentioned jobs. Some of the jobs, accidents are pretty high with men.
I couldn't believe that 92% of fatal workplace accidents are men. That blew my mind. But historically, we have taken the harder jobs. We've seen that as our duty, and we're proud of that. And I think sometimes that pride hurts us. That's just a fact.
Now, there's some screening things that men need to be aware of. Go over some of those for us.
Okay. So in a typical visit to a doctor's office now, you almost can't get away without getting your blood pressure screened, your weight screened. We're going to look at some of your other vital signs, but potentially some of your lab work. We need to know if your cholesterol is high, and we need to know things that you can't feel. So if we're wanting to see your kidney function, or if we want to know if you have too much hemoglobin from hemochromatosis, we're going to check it and then work with you on it. I swear some guys think that they're going to show up and get told they have a disease, and that's not what we're there for. We're just there to give them some guidance.
Now, one thing too is not necessarily that we think of as a organic disease, but the mental health issue, men don't seek a lot of help for that either.
No, we don't. It's why we lead in suicide rates, death from depression. And it's usually it's a meaningful moment when a guy opens up to me about that in clinic. A lot of times we can get a really good result without a lot of effort. And it just takes talking about it, which, depending on the generation you're from, you may have been taught you don't do that. So it's a little bit of, searching yourself for what you're willing to open up about.
So all the basics we tell everybody is really true for men too. Diet, exercise, get your screenings done, and see a doc.
Yeah. It sounds nice to say everybody should exercise. Some people are just going to get that from their jobs, and that's an okay thing. Just make sure that job is not putting too much strain on a joint that's going to lead you to see Dr. Brown or Dr. Spears. Other times it's as simple as saying, hey, the diet that you love so much, the grill that you want to cook on every night, you got to cut that in half, and it can make a big difference. Add years of your life. It can add better years to your life. It's really tough to look at your future self and decide you're going to do something for him, but he needs us. So, yeah.
Well, and it's time to take care of it now. We appreciate you coming in.
Yeah.
Thank you for the information. Thank you for the care you give our patients at Family Practice Associates.
Absolutely happy to help. Yeah.
All right. And if you're one of those men out there that haven't seen your doctor, make sure you schedule it. We'll be right back.